The treatment of nystagmus in the UK is very much dependent on what the patient. This could be A. Optimization of visual function, B. Management of neck strain that has developed as a result of an anomalous head posture, for example, like this, or C. Improvement in the appearance of the eyes. There are three broad categories of treatment options. This includes A. Optical, B. Medical, or C. Surgical options. So starting with the optical treatment options, the first thing that we do for every single patient with nystagmus is check their refraction and prescribe glasses. This is a very simple measure that can be quite effective in optimizing visual function. We can advise tints and sunglasses in certain kinds of nystagmus where there is an associated sensitivity to bright light, for example, albinism or achromatopsia. Contact lenses are particularly useful in cases of significant astigmatism or head posture, where it is much more difficult to look through the center of the glasses and use the null point at the same time. We can also combine glasses with prisms to help shift an eccentric null point to the more useful straight ahead or primary position. Now, coming to medical options, there are several medical options or medications available that we can use to treat adults with nystagmus in the UK. The two most commonly used drugs are the anti-seizure medication gabapentin and a drug used to treat Alzheimer's called memantine. Basically, these two drugs dampen down the electrical signals in the brain that are triggering the nystagmus movements, and in doing so, the nystagmus is dampened and visual function is improved. These drugs are particularly effective in infantile nystagmus that has a pendular waveform. Now, moving on to surgical treatment options. Surgical treatment in the UK normally involves an operation on the muscles of the eye in order to shift an eccentric null point closer to the primary or straight ahead position. This treats any associated neck strain as well as optimizes vision. In addition, this surgery can be combined with correction of any associated squint and improve the appearance of the eyes. For those patients without a head posture, surgical options are more limited. We can sometimes perform a tenotomy procedure where we can detach and reattach the horizontal eye muscles in the eye. This alters the feedback from the muscles to the brain and can help dampen the nystagmus and improve visual function. This can also be combined with squint surgery procedure in order to improve the appearance of the eyes. Finally, I was asked to mention the work that we are doing in developing a treatment to optimize eye development and visual function in children with albinism. This treatment is a drug called levodopa, which is normally used to treat Parkinson's disease and children with limb movement disorders. Levodopa, for those of you not familiar with it, is a chemical that is very important for normal retinal development. It is normally produced as part of the pigment synthesis pathway. This pathway does not function properly in albinism, resulting in a lack of levodopa and abnormalities of retinal development. This then results in visual impairment and nystagmus. Now, we know from our ability to improve vision in children with lazy eye using patches and or glasses that there is a critical period in early childhood when the visual system and the brain is still very changeable and adaptable. In albinism, we think that the critical age is before 18 months of age. Therefore, we hypothesize that administering levodopa during this critical period in albinism will optimize retinal development and visual function. We are currently in the early stages of planning a trial of levodopa suspension treatment in infants and young children with albinism in order to confirm if we can indeed improve their retinal development and their eyesight. Hopefully, the next time we speak to you, we will have some results back from this trial. Thank you.